Welcome to The Explainer. Today, we're jumping right into a deeply personal, often whispered about, and honestly, frequently misunderstood aspect of postpartum health. We are shedding light on the realities of how the body actually heals after childbirth, specifically focusing on the perineum and the vagina. I am so thrilled to guide you through this because, let's face it, empowering ourselves with real medical facts is the absolute best way to dispel fear and optimize our healing. So let's dive straight into our core focus for today. Can an episiotomy actually affect tightness at the vaginal opening? It's a highly sensitive topic, and it is heavily clouded by outdated medical myths, rumors, and some pretty intense societal pressures about how a postpartum body is supposed to look and function. Right off the bat, I want to validate a very common concern. Feelings of vaginal looseness or laxity are incredibly common right after giving birth. It is a totally normal part of the postpartum reality. I mean, your body has just done something structurally monumental. Feeling a change in width or openness is something the vast majority of people experience right after delivery. Section 1. Postpartum vaginal changes. What actually happens after birth? Look, the vagina often appears significantly wider at first, which makes total sense given the sheer mechanics of stretching. But here's the thing. Much of that initial openness actually subsides within just a few days as the initial swelling goes down. What you're left with is a healing process. This involves perineal soreness and, critically, the potential formation of scar tissue, depending entirely on how the tissue stretched or tore. That brings us to Section 2. What is an episiotomy? Let's understand the procedure. When we map out the anatomy of the perineum, that space between the vagina and the anus, you can clearly see exactly where natural tears occur, ranging anywhere from 1st to 4th degree, and you can compare that to where an episiotomy cut is purposefully made by a doctor to widen the opening. So, by definition, an episiotomy is that surgical incision. Decades ago, this was a perfectly routine practice for almost every single vaginal birth, done under this belief that a clean cut healed better than a natural tear. But, well, medical research has definitively proven that false. Major medical organizations now strictly recommend against doing it routinely. Today, it's reserved only for specific medical emergencies. Section 3. The husband stitch myth. Unpacking a dark medical practice. This forces us to confront the myth of the quick fix for vaginal looseness. You might have heard whispers of the husband stitch or the daddy stitch. Basically, it's the highly unethical practice of placing an extra, medically unnecessary stitch during vaginal repair after childbirth. Its supposed purpose? To tighten the vaginal opening to increase sexual pleasure for a male partner. And horrifyingly, historically, it was often done without the explicit consent of the patient. Just to give you a sense of the reality of this, listen to this actual quote from a doctor to a patient's husband moments after delivery. Yeah, let's go ahead and add in another stitch so we can make sure this is nice and tight. It perfectly and sadly illustrates how this objectifying, non-consensual practice has historically played out right there in the delivery room, completely ignoring what the patient actually needs medically. But the fallout from this is severe. Fast forward a few years and contrast that doctor's quote with a discovery from a midwife examining a patient who'd been in excruciating pain for 5 years. She said, "This is not right. He gave you what some people call a husband stitch. That extra stitch absolutely didn't optimize her healing. It caused long-term dysfunction, pain, and profound confusion for the patient." So, getting back to our core focus. Can an episiotomy and extra stitching actually make a vagina tighter? No. Stitching can only shrink the opening of the vagina at the surface, the introitus. And that inappropriate tightening at the entrance is exactly what causes severe pain. It does absolutely nothing to restore actual vaginal tone. Tone is dictated by the pelvic floor muscles deep inside, which are, you guessed it, completely unaffected by surface-level stitches. Section 4. Scar tissue and pain. The reality of tightness. Let's look at what's really happening physically. When people feel like an episiotomy has made them tight, what are they actually feeling? Well, they're feeling scar tissue. Whether you have a natural tear or a surgical episiotomy, your body naturally rushes to produce a protein called collagen to bind the wound together, effectively creating a scar. But think about the characteristics of scar tissue for a second. It's firm, it's raised, and it's uneven. Most importantly, it completely lacks the elasticity and flexibility of normal vaginal tissue. When those collagen fibers overlap to close a wound, they create a very rigid area. That rigidity is the exact reason the vaginal entrance feels overly tight or sensitive. And this lack of flexibility leads directly to a condition called dyspareunia, which is just the medical term for pain during sexual intercourse. When you connect the dots between that inflexible scar tissue at the perineum and the potential for inappropriate overstitching we talked about earlier, it becomes crystal clear why so many people experience severe pain when attempting to resume physical intimacy. Section 5. True Healing and Recovery. Evidence-based solutions. We know the myths, we know the complications, so let's shift gears toward how we actually heal. The medical literature outlines 3 backed, effective approaches to resolving postpartum laxity and managing painful scar tissue: pelvic floor exercises, targeted perineal scar massage, and for severe cases, scar revision surgery. First and foremost, pelvic floor exercises, or Kegels. I literally cannot emphasize this enough. Internal muscle exercises, not external stitches, are the true secret to restoring vaginal tone and structural support. This is the scientifically proven method to tone the muscles wrapping around the vagina and to prevent massive headaches down the road, like urinary incontinence. Now, for dealing with the physical scar itself, perineal scar massage is an absolute game changer. It's a simple routine. Apply a suitable lubricant, insert your thumbs just enough to feel a stretch, and massage gently in a U shape for 2 to 3 minutes every day. Doing this helps break down that stubborn, rigid collagen, which returns flexibility to the tissue and greatly reduces pain. Finally, we have to acknowledge that sometimes conservative measures just aren't enough, and that is okay. If massage doesn't work and the pain from poorly healed episiotomy tissue is severely impacting your quality of life, episiotomy scar revision is a completely valid medical option. This is a targeted surgery performed by a specialist to carefully remove that hardened scar tissue and reconstruct the area properly. So as we wrap up and look at the real data surrounding postpartum recovery, it leaves us with a pretty crucial question to ponder. Are we treating postpartum bodies for optimal, pain-free function, or are we treating them to satisfy outdated, frankly objectifying expectations? The evidence clearly shows that true tightness comes from healthy muscle tone, and true healing comes from flexible, cared-for tissue. Prioritize your healing, listen to your body, and never, ever settle for a medical myth over your own comfort and health.